between Tuesday, June 14th and Monday, June 20th, our PCR test positivity rate ranged from 8.7 to 14.9%, with an average of 12.3% for the week. As you heard, currently there are 661 people with COVID in hospital, including 17 in the ICU. Sadly, between June 14th and 20th, 13 deaths related to COVID-19 were reported to Alberta Health. It is important to remind ourselves that each number is a person and that COVID remains a threat in our communities. My thoughts are with the family and friends of these Albertans and anyone who has lost a loved one recently, no matter the cause. Incorporating what we have learned from COVID into routine practices in these settings will be especially important during the colder months ahead, when we expect a rise in COVID cases as well as seasonal influenza and other respiratory viruses. I know that many have asked why we have shifted the isolation requirement to a recommendation if we expect cases to rise in the fall. As the Minister has mentioned, we are not alone in moving from legal requirements to recommendations, as other jurisdictions have also lifted their orders. While COVID will continue to pose a risk, we are no longer in a place where we need an emergency public health order to remind us that we should stay home when we are unwell. I would also like to remind Albertans that living with COVID-19 does not mean that it is going away. It means that we have the tools at our disposal to lift mandatory emergency public health measures and transition to other approaches to minimize risk. And it means that vaccines will continue to be critical in protecting our health, our loved ones, and the healthcare system.
You know, when we take a look at the choices that we made historically, we recognized that it needed to be a balance, right? A balance based on the tools that you have available at the time, and based on the nature of the disease that we were dealing with at the time. And I fully appreciate that that has changed over time. The nature of the disease. When we made some choices to put in some measures to protect Albertans, that was in recognition of the nature of for example, the Delta wave at that point in time, and it was trying to strike a balance, because on the one hand, you look at choices that we made at that point in time to try to not only protect our healthcare system but protect the lives of Albertans, and trying to minimize the impact, because there's negative impacts on both the measures you put in place and dealing with Delta. So it's always trying to find a balance. You look at certain other jurisdictions, like particularly in the U.S., which has a death rate 3 times higher than Alberta. You look at some of the assessments that was done in terms of Alberta policy choices that we made, that we tended to have the fewer restrictions than you saw across the country, and still a death rate, at certain points of time, when we look at the last analysis I saw, lower than the average within the country. So these are all choices that we made, and it's also now the one thing that when we looking forward and we learn to live with COVID, what do we have going for us now? Well, we have vaccines in a relatively high level, people with 2 vaccines vaccination rate. We have antivirals that we can depend upon. We are expanding capacity within our healthcare system, and that was one of the #1 jobs that was given to me by the Premier when I became Minister of Health. And also we understand that generally speaking, the nature of viruses like COVID-19, as you go through different variants, tend to be perhaps more transmissible, but less severe. And we're seeing that being borne out in COVID, with the Omicron waves. And I'm hopeful that trend continues, because that's what the science says. But is there a guarantee it is going to? The answer is no. So all we can do is deal with the situation that's in front of it, and make the best choices that we can with the tools that we have, and strike the right balance.